We are all acutely aware of the severity of the opioid and fentanyl crisis in our communities. As a county and as a board, we have been moving aggressively, faster than any point in history, to do more to try and address the realities, the substance abuse crisis, and in particular the opioid and fentanyl crisis we see in our communities. We are on the precipice of the County of San Diego receiving a large settlement from Purdue Pharma in the case that has been underway with multiple jurisdictions. And although those funds are not here, we think that it is imperative that we are absolutely ready and prepared to invest those funds in a way that can save the most possible lives as quickly as we get them, which means we need to do the work on the front end before the funds have arrived, to have an absolutely solid, effective plan in place so we can make that investment as soon as we are. And this is really the county preparing in advance to be able to save as many lives and do as much good as we possibly can. And the challenges that we've seen around opioids has been increasing, 16% increase in deaths this year from last year. But the simple reality is it has been increasing year over year, every single year for more than a decade. The severity and scope and size of this problem is tremendous. As a county, we stepped up when I first joined the board to get involved in suing Purdue Pharma. I believe the Sackler family should be in prison for what they did. But that option is not available to us. The only option we have is to sue them civilly in court, and we have done that. And we will sue anyone else who was involved in intentionally triggering a humanitarian crisis and a massive tidal wave of addiction throughout our country because they wanted to make money. It was morally wrong, and the impacts of this will be felt for generations to come. Fortunately, the court system is going to intervene, and I believe San Diego County could be receiving up of $100 million in funds specifically targeted to address the opioid crisis and addiction. And I'm incredibly grateful for my colleague, Supervisor Joel Anderson, whose district has been hit harder than probably any part of San Diego by the opioid crisis. And we are committed together to investing the time to meet with the experts, with community groups, with medical groups, with addiction specialists and experts, with everyone who has a thought on what we might do to best address the opioid crisis, and invest the time to get everyone to the table and come up with a plan for the Board of Supervisors to consider on how we can invest these funds. And we want to do that before we receive the funds. Our 3 planning sessions are scheduled for August 10th, September 6th, and September 7th. At each of these, we will have individuals who interact with those who face addictions, emergency room doctors, harm reduction advocates like some of those who are here today, individuals with lived experience, family members, anyone who has an idea on how we can best save lives in San Diego County will be welcome. And Supervisor Anderson will work along with county staff to develop a comprehensive approach that will then be brought before the Board of Supervisors. And it will be the board's ultimate decision for what will happen. But again, we want to put in the hard work on the front end to be able to do it. October 4th is when we're planning to hold a public hearing to share the findings of all the work that's been done and the proposed plan. And then after that, but that same month, we will come to the Board of Supervisors and ask for ratification of this framework for how we would invest these funds. But I want to make a point that when we talk about the lives lost from opioid, it is generally a number, it is a statistic, it is how many lives have been impacted. But the reality is, as I shared in my State of the County, is every single one of those lives lost was somebody's child. It was somebody's brother or son or cousin or uncle. Every one of these individuals, if not for opioids, would still be alive today. And I shared at the State of the County the story of Alex Nava, 23 years old. He had his entire life ahead of him. His family will tell you that he was known for an infectious spirit, an amazing smile, and a tremendous love of family. Alex had a skateboarding injury, which led to an OxyContin prescription. That prescription led to addiction. Addiction led to an overdose. And a year after he started OxyContin, Alex Nava was dead. When you talk to his mom, Lisa, who was here with me at the county just a few weeks ago, as a parent, it will wreck you to hear her talk about, as a parent, our only obligation is to protect our children, and she could not protect Alex. And the nature and reality of addiction is it overwhelms everything else someone can do. And we've got to stop blaming the individual who is addicted. We've got to start meeting them where we are, engaging them in the situation they are with compassion and empathy and love, and providing every possible treatment option we can to help them get back on track. And it's in the memory of Alex Nava and every other life lost across San Diego County that we work so hard to try and impact and get ahead of this issue. We haven't waited for these settlement funds to act, and I think this is a really important point. What we will do with these settlement funds are additive to everything that we have already done. Early last year, the board gave the Behavioral Health Services team the authority to implement industry best practices to help people manage addiction to opioid and help them connect into treatment. And I want to thank, we've got some folks here, the great partnership with Family Health Centers of San Diego. Jeff Gehring is here, and they're a big part of the Harm Reduction Coalition of San Diego. And Jeff, we appreciate you. And of course, I can't talk about the importance of harm reduction without recognizing Tara, who's here, Tara Samos-Busig, who has been a leader, who has stood with me time and again, who has taken me out to the sites and shown me the work and been such a leader, was recently featured in the Union Tribune, a tremendous profile on your work and everything you're doing to change the stigma. And I appreciate, Tara, when you tell your story. You are the model of the road to recovery, and people see in you the potential and opportunity, and you've helped us move county policy, and we're grateful and appreciative for what you're doing. I also want to thank our public health department. Dr. Wilma Wooten issued a standing order for naloxone. Naloxone, which you will see here on the table, is a life-saving treatment that can help anyone facing addiction and overdose. And San Diego County issued a standing order, basically prescribed naloxone to all 3.4 million people in our county who can carry it. Our county is receiving more and distributing more than ever before. First responders, social workers, anyone out there, any San Diegan can be in a position to take naloxone, and we appreciate and are grateful for that. And we continue to build out our addiction treatment services. Included in our recommended budget is additional funding for more treatment services and more outreach workers. I want to thank Dr. Nicole Espinito, our Chief Population Health Officer in the Department of Behavioral Health, for being here and helping us in these programs as well. So we have a lot of work ahead of us. We are doing a tremendous amount. We know that we want to do more, and we really want to be prepared as a county. My guess is other counties that receive funds, when they get the funds, at that point, they'll probably start thinking about what they should do. But at that point, if you know what you're going to do, then you're ready to put it on the streets. And the quicker you act, the more people you can reach and the more lives you save. And even if it's one life that gets saved, because we move faster, then it is completely worth it.